whenever you're ready.
I would like to discuss for a couple of minutes what we call fibromyalgia. I'm not going to tell you what is fibromyalgia. We are not going to go to the description of the syndrome by itself, because you can read it in any place there. But fibromyalgia, in my experience, is a misunderstood type of a trauma. Usually, it's a lot of people that they have just small accidents, a fall, sometimes a car accident without really consequences. Maybe somebody bumped the car on the back, going 5 miles an hour or so.
So you're saying something you don't feel right away.
Something that you don't really feel immediately. And then this creates some type of a situation where you have, when you're ready to have the accident and you see in the mirror the other car is coming, you really become tense. You grab the driving wheel and then you put your foot in the brake, or you do something like that to defense mechanism. And when that happens, you can have small little type of injuries on ligaments and tendons and muscles. And that creates some sort of resentment in the body. And the major trouble is you go to a physician. Initially, you don't feel anything. And then a couple of days after, you have a little shoulder pain, a little headache. Sometimes you do have some wrist pain or knee pain because you maybe bump your knees against the dashboard and things like that. That type of a situation creates a chronic picture. And that chronic picture is pain all over your body. So you hurt on the wrist, you hurt on the elbow, you hurt on the shoulder, you hurt on the back, you hurt on the neck, you have a headache, you have a toe pain. I mean, everything hurts. But it's not a really bad hurt, but it's all over. When you have that type of a situation, usually you go to a doctor, and they give you pain medication, they give you some physical therapy, they advise you to visit a chiropractor and things like that, that they are the routine behavior for this type of an injuries. Sometimes that resolve, sometimes become chronic. And when that happens, the patients become in a chronic stage of treatment. They are constantly taking pain medication. Then they start to be affected. And one of the problems is they feel angry, they feel depressed, they start to take medications for the pain, what decrease the strength of the nerves. Then you continue with taking narcotics, and so on. Then you go several times to a doctor, and then you have now anti-inflammatories, you have injections, you have chiropractor treatments, and still this thing doesn't go away and becomes now a situation that is chronic. There are even associations of people that they try to get some answers, and they form groups. And this group is a group for individuals that they have, quote unquote, a diagnosis of fibromyalgia. Fibro means fiber. The structures that they have fiber in your body, like tendons and ligaments. And myalgia means pain. That is a ligamentous type of a structure that creates pain. Well, if this persists and you are taking these medications, first than anything, you are very much a poor worker because you have so much pain that you go to work and then come back and then ask for vacation and ask for it, permission to go to a doctor and take this medication, and then becomes a routine. Those individuals are practically become antisocial. They have so much pain that they cannot live very much in society without saying, I hurt here and I hurt there. And it's bad for them, and it's bad for the companion that is with that person, it's bad for the family. And then become isolated a little bit. And every time that they complain, the people go, here again, we have the same problem. They cannot have a relationship in friendship relationship. They cannot go to a restaurant and be comfortable. They cannot go to a movie and be comfortable. So become practically an individual who is depending all the time of this pain.
Are they doomed to that? Are they doomed to pain forever?
Well, that's what they do. They are practically individuals that they are going to not being social. They cannot be social. Then they get in groups like that to talk about, and they talk about what do you take that help you for this pain? Who is the doctor who treats you for this other pain? Why this headache suddenly disappear from you? Why you have this other situation that makes me so miserable? Well, when that start to happen, then they become depressed. And the next thing that start to take is medication for depression. So that narcotics, medication with depression, bad relationships in the relationship, bad relationship at work, isolate them more and more. And then they focus totally on this pain. Well, I described to you what really is happening with this person. But what is the answer? If you suffer of this problem, I promise you that you visit your general practitioner and he give you medications for anti-inflammatories, muscle relaxants, antidepressants, pain medication, narcotics, all this you went through, and still it's not working. If you continue with this, then you start to ask to these associated groups what really helped for you, or where did you go to help you, and did you get help or not? And then really what happened is becomes neurotic, becomes really focused. All the life of the individual is based on this amount of pains. It shouldn't be like that. This is an impact on the nervous system. And the nervous system is resent this, let's call it the small accident. That is not really small because it's all changing the life of this person. So what you do then is you start to look what really is the initial accident. Well, the initial accident is probably another syndrome that we call whiplash injury. The whiplash injury is nothing more than the flexion and extension problem on the neck and on the lower back. But all these components there are affecting a large amount of nerves. So what you need to do is you need to analyze which nerves are being affected and how to treat that. And just narcotics are not going to do it. Just anti-inflammatories are going to help a little bit, but not enough. just physical therapy is maybe help them, but not enough. Or it's going to take months and months to get better. So in my practice, I had a lot of people who have fibromyalgia. And what I discovered here is you need to focus on what was the first symptom that this patient had. And usually is a flexion extension injury on the neck. And the areas where the flexion extension occur is always in between C5, C6, C6, C7. That is the area more fragile on the neck. The head weighs 20 pounds. And when you throw a ball of 20 pounds forward and then backward in a structure that the vertebrae are very small in the neck, and you force these structures to be moved, then usually the results are in association with different pains. And usually these people goes and say, I have a bad headaches. And usually these people goes and say, but the pain start after the accident. I have like a frozen neck, and then my shoulders hurt. And then I start to have pains that go to the back of my shoulders. Then I start to have the pain that goes on my arms, and then went to my hands. And it's better now after 6-7 months, but it's not totally gone because I have now pains that they are in my lower back, and I have pains that go on my legs. So as you see, the problem starts on the neck and start to run down to other nerves. So what you need to do, you need to arrest the thing as soon as possible. And one of the things is, for example, if the patient had a car accident and you say, oh wow, this can be a whiplash injury, you need to treat the whiplash injury as soon as you can. And anti-inflammatories will help. Pain medication will help. Physical therapy will help. But what really, really will help is to analyze which nerve is the one who had most of the injury and treat it. And usually is the sixth nerve on the cervical spine, and it's very classical that the first symptom that they have is bad headaches. So that's what I did with people with fibromyalgia, and start to tackle one in the very beginning, the nerve that I thought was practically the one that has the major injury. And the results are really very good. So I'm talking about fibromyalgia because I heard that they are a tremendous population with this problem, that they are groups, that they meet to find how they can correct this problem. Like a spine surgery is a situation today in the country that is affecting enormous amount of people. In last year, for example, just operating the back, 8 million people were treated. So unfortunately, these treatments with radical surgery, that they require open surgeries and screws and plates and devices and artificial discs and all these things, they don't correct the problem. They add to the problem. So the patients have the surgery, and then they have 6 months in a lot of pain after the surgery. And then when they start to get a little bit better, the screws and plates start to get loose, and then the situation starts again. So I don't advise that type of treatment, but I do advise a selected type of information of where and which one was the first nerve that created the problem. And start with the block first. Block the nerve and see if that corrects the problem for a while. You just put a little bit of xylocaine on the nerve, and if the patient goes, oh, wow, my pain is gone, then maybe you need to treat that level and decompress and do a foraminoplasty in that area. But it needs to be early. You need to identify early the problem, because you try to do it when it's in a chronic stage, then the situation is that you need to deal with different nerves and different treatments. And some of those ones will be surgical.
So the moral is get to it early, right?
Correct.
And then come see you so that you can pinpoint the source of it.
Well, what they can do, if anybody that is hearing this is interested in talking to us, we'll be very happy to have a conversation so I can guide them or maybe treat them. So call the Institute and ask to have a surgeon to discuss with you your problem, and we'll be more than happy to guide you.
Excellent. Dr. Bonati, thank you so much for your time. And if you or somebody you know is suffering from neck backside pain, like Dr. Bonati just said, reach out to us or visit askbonati.com, and we will see you next time.